Good afternoon, and to those of us joining online, welcome. My name is Stephen Kopechka with Resolve to Save Lives, and we're delighted to have you with us today for our event, Trans Fat Elimination, Global Progress Towards the Target. You'll hear from policymakers, experts, and industry today as we talk through some of the progress we've made over the last many years on eliminating trans fat. We are happy to have you with us. And before we begin with our official program here in person, we have two video messages from Dr. Tedros Adhanom Ghebreyesus, DG of WHO, and Dr. Tom Frieden, President and CEO of Resolve to Save Lives. So we're delighted to have you with us, and thank you for being here.
Your Excellencies, dear colleagues and friends, every year, up to 500,000 people die from the consequences of eating trans fat. An ingredient in many processed foods, trans fat is a key risk factor for cardiovascular disease that can and must be eliminated. But simply, it's a toxic chemical that has no place in our diets. In 2018, WHO launched the Replace initiative and called on governments and food manufacturers to end the use of industrially produced trans fat by 2023. At the time, just 7% of the world's population was protected by regulation against this deadly additive. 5 years later, almost half the world's population is covered. We have demonstrated that the elimination of trans fat is achievable, affordable, and effective, with significant health benefits. Under the newly established WHO validation program for trans fat elimination, WHO commends countries taking a stand against trans fats by implementing best practice policy. We hope this will encourage further governments to do the same. Food should be a source of health, not a cause of disease. It's time to banish trans fat to the dustbin of history. I thank you.
Today, just 5 years after the World Health Organization called for the global elimination of trans fat, by the end of 2023, nearly half the world is protected from this toxic, unnecessary chemical. This progress will prevent deaths from trans fat of approximately 5 million people. Industrially produced trans fat is made by bubbling hydrogen gas through liquid oil. This makes the product solid at room temperature. Unfortunately, it's also solid in our coronary arteries and can kill us. Trans fat is the unhealthiest of all oils. It raises the levels of unhealthy fat and lowers the levels of healthy fat. Replacing trans fat with healthier oil doesn't change the taste, cost, or availability of great food. Before countries began banning trans fat, it was estimated that there were as many as 500,000 deaths from trans fat every single year. In the past year, Egypt and Mexico, two countries which had high burdens from artificial trans fat, have taken action to ban the product, as have Argentina, Nigeria, and Oman. Leaders in 51 countries have banned trans fat, and they deserve credit for taking action that will save lives of their people. The world is almost halfway there in terms of the population covered by trans fat-free regulations and laws, and about 2/3 of the way there in terms of prior consumption. China, Pakistan, and Indonesia have the remaining highest burdens of trans fat without any policy protection, although we hear that encouraging progress is being made in Pakistan and Indonesia. Iran and Russia have some but not best practice regulations to protect their residents from this avoidable source of heart attacks. People in Eastern Europe and Central Asia continue to suffer many deaths from trans fat, and any country that hasn't taken action is at risk of having trans fat dumped on them from producers that haven't stopped making this dangerous product. There are 3 remaining priorities to achieve a trans fat-free world. First, finish the job of regulation. 5 countries account for an estimated 2/3, and 15 countries for about 80% of the remaining deaths due to trans fat. 4.5 billion people remain unprotected from trans fat. Governments can stop these preventable deaths by passing and implementing best practice policies. Second, ensure that regulations are enforced. WHO has created the Trans Fat Free Validation Program, essentially validation that a country is trans fat free. Third, ensure that companies comply with the law and work with them to increase the healthfulness of the alternative fats being used. Because trans fat is made in a small number of large factories, identifying these factories and ensuring they're no longer producing trans fat is a feasible enforcement strategy. Industry needs to continue to step up. Cargill committed to ending production of trans fat this year. It was previously one of the major global producers of trans fat. Every producer should do the same. We're so pleased that the Access to Nutrition Initiative is joining us today to share the results of a multi-country study on food industry commitments to eliminate trans fat. Trans fat elimination proves that effective action on nutrition is possible. Other life-saving nutrition programs include those to fortify salt and other food with iodine and folate to prevent birth defects, tax sugary drinks to combat obesity, reduce sodium consumption and promote consumption of low-sodium salt, and reduce consumption of ultra-processed foods, which are associated with a broad range of health harms. We should be proud of the progress the world is making toward becoming trans fat free. In just 5 years, countries have taken action that will prevent at least 5 million deaths over the coming decades. In the coming months, the world can finish the job and end deaths from trans fat forever. Thank you.
Please welcome to the stage Greg Garrett, Executive Director, Access to Nutrition Initiative.
Good afternoon, and for those of you online, good morning or good evening, wherever you are. Thank you for coming and thank you for listening to this very important topic. My name is Greg Garrett. I'm the Executive Director of the Access to Nutrition Initiative, which is a global nonprofit which exists for the sole purpose of trying to transform markets so that more nutritious food, more affordable food is available for all. We're very excited about this event and the research that we're going to present here to you now because it's a positive story. Overall, we're seeing a lot of progress from industry and as well as from governments on self-regulation from the industry side, as well as regulation from the government side. Just a moment about the Access to Nutrition Initiative. Who are we? So we're a global not-for-profit that takes funding only from government and philanthropies. We don't take funding from the industry, and that's an important point for today's event because we want to make sure that our results when we monitor companies and we try to hold them to account are impartial and as independent as possible. We have an independent board and pro bono expert advisors from various universities around the world. We're 21 staff, most of whom are in the Netherlands. Our overall goal in our new strategic plan is that the sales of food products around the world is derived primarily from healthy products. As of today, if you were to go into a grocery store, for example, and pick up a packaged food in just about any setting, be it a high-income country, a middle-income country, and even low-income, that packaged food is going to often be processed, and 70% are unhealthy. That is, they have too high levels of salt, sugar, fats, including industrially produced trans fats. We would like to see that number be much more around the halfway point and even better. We'd like to see more than half of all products and all sales derived from healthy products. So let me share about the context of the research, the scope and methodology, the results and the recommendations. I'll also point out that my colleagues who led on this work, Bo-Jane Woods and Mark Vine, are here with us. So afterwards, when there's Q&A, I hope between us we can answer all of the questions that you may have about this important research. So in terms of context, The intake, as we've just heard from Dr. Tedros and Dr. Tom Frieden, is that intake of trans fatty acids, both types, ruminant or natural, as well as industrially produced, is leading to 500,000 deaths a year. And that's mainly from heart disease, heart attacks. They come in two forms, as mentioned, and the elimination of the industrially produced trans fatty acids is a priority for the World Health Organization, for the Access to Nutrition Initiative, Resolve to Save Lives, and many other organizations, as well as now industries and governments around the world. In 2018, there was an initiative that was launched by the WHO, which was calling on industry to voluntarily remove these ITFAs from their product portfolios by 2023, this year. So how are we doing? And basically the goal was to remove that so that there were less than 2 grams for every 100 grams of fat and oil in their products worldwide. We were commissioned by the WHO to look at the progress towards that target from the industries. So in terms of scope, we started with the 11 companies who are members of the International Business Association, International Federation of Business Alliance, and we have the representative with us, Rocco Rinaldi, who will be sharing with us in a moment. These are the 11 companies that we looked at who signed the commitment to reduce ITFA in their products. In terms of the markets where the companies are most active, we looked at 14 different markets or 14 countries, and they're a mix of high income as well as middle income countries. And you can see, sorry about that, you can see that there's a good mix between highly populated countries like India and the US and China, as well as some smaller countries in scope. We looked at the 7 most high-risk product categories. These include baked goods, confectionery, dairy, frozen desserts, ready meals, savory snacks and sweet biscuits, snack bars, and fruit snacks. Now, those 14 markets, 11 companies, and those 7 product categories, the data we collected on the food products from that segment of the market represents 10% of the global food supply. We believe that it is largely representative of the larger food products. So the results you see, we hope, also apply to the broader markets around the world. So let's look at the methods. We had both qualitative as well as quantitative methods. We had 3 sources for our qualitative assessment. Firstly, we looked at the statements themselves from the industry. You know, what are they publishing online, on their own websites, on IFPA's websites, in terms of their commitments to removal of ITFA. We looked at the data from our own global index, which was run in 2021, and we looked at IFPA's website. For the quantitative data sites, we had 2 sources. The first one was, again, the data from our global index, and the second was asking the companies to provide product-level data. Now, the data came in very disparate ways, and so we had to apply some different search criteria. This included looking at keywords like specific ITFA, hydrogenated vegetable oil, hydrogenated oils and fats, to get to the data set that would allow us to do the assessment. This slide represents the flow of data and how we eliminated unnecessary data from the assessment. We started with over 27,000 products. Then we looked at products that contained any form of trans fats, the natural as well as industrially produced. Then we looked at those products that had more than 2 grams per 100 grams. Then we separated that category between the natural trans fats and the industrially produced trans fats that were above the threshold that WHO has put forward. What are the results? I'll start with maybe the, I'd say, more disappointing results. If I can get to the correct slide, it jumps on me. I'm not sure why it's not going to give me the slide, so I might have to just speak from memory. Basically, in terms, I can't get to that slide, unfortunately. The publication of the commitments were lacking. So the commitments were made, but the actual companies that published them online were only 6 out of the 11 companies, right? When it came to the mechanisms for control, the internal mechanisms, only 3 companies published in the public domain the mechanisms they used for controlling ITFA in the public domain. Came up, thank you. In terms of putting this commitment online on IFPA's website, 5 of the 11 companies did that. And you can see that 5 of the 11 actually put progress on their commitments, or they were publishing regularly the progress. So there's some work to be done, we believe, in terms of the companies publishing on a regular basis the commitments as well as the progress towards the targets. Okay. Now, the results for the quantitative analysis. We started with 27,920 total products assessed. 14,000 of those had some level of trans fats, either natural or industrially produced. But the good news is that only 1,300 of the products had more than 2 grams per 100 grams of fats and oils, but only 28.1% of all the products assessed had a unacceptable level of industrial ITFAs in the products. This is very good news. The conclusion here is that in terms of the 11 companies assessed and the 14 markets that we looked at, there has been very strong progress across the board from all the companies on removing ITFA. It means reformulation is working. It means replacement of ITFA in those products is also working. If we look at the market, however, there were 7 countries where we see some need, prior slide please, yeah, where we see some need to improve the mechanisms for monitoring. They come in 3 categories. So firstly, the countries where we're seeing a higher level of ITFA in the products than there should be on average are Australia, Vietnam, and New Zealand. Here we don't yet have known or reported measures in place to monitor ITFA. There's complementary measures in Pakistan, but they're quite light, so there could be work to be done in Pakistan to strengthen that. And then in Nigeria, Hong Kong, China, and in Italy, we have recently approved good practice, so that's good news, but because it's recently approved, there's work to be done to institutionalize those policies and monitoring mechanisms for ITFA in the supply chain. So, summary of findings. All companies assessed, all 11, very good progress. 0.1% of all products had an unacceptable level that was above the WHO target in terms of ITFA in the products. However, progress is uneven across the companies, the food categories, as well as the markets, the countries. Packaged baked goods as well as confectionery, it's not on the slide, those were the 2 highest risk categories where we're seeing quite a lot of need still to remove this harmful substance from the products. And also, there is clearly need for countries to continue to firstly establish, if they're not already there, establish mandates to control ITFA, to eliminate it, and then to monitor it. What are the recommendations? There are 3. Firstly, on reporting. It was very hard for the Access to Nutrition Initiative team to take disparate data sets and work out a coherent message from this because the way the data was coming in was not standardized, harmonized, and we would call on industry to have a standard mechanism for reporting on this. More companies. We're only looking at 11 of the world's largest, I should have mentioned. These were some of the largest companies in terms of revenue as well as product portfolios, but it was only 11, 10% of the global supply. We want to see, as Tom was saying in his video address, we would like to also go to the suppliers of the oils, suppliers of the trans fats, and make sure that they are not supplying ITFA to the manufacturers. We also would like to see national companies assessed. We need resources to be able to do that. Thirdly, on policies, clearly there is a great opportunity for best practice, which has been seen in many countries now, to be rolled out in new countries, and for the enforcement mechanisms to be strengthened. So it's an exciting message overall. Countries as well as companies are eliminating industrially produced trans fatty acids from the food supply. And if we can put these recommendations in place, we're confident that we'll get to a complete elimination very soon. Thank you very much.
Please welcome to the stage Rocco Rinaldi, Secretary General of the International Food and Beverage Association.
Good afternoon, and I'll be very brief because, in essence, the IFPA commitment has been met. In fact, it's been met entirely since the ATNI report has been published. So the research that Greg helpfully presented was conducted over the last 2 years. I think it took, it was quite a substantive endeavor of data gathering and imperfect report based on imperfect reporting and data sets. So I'm pleased, Greg, that you were able to complete this work and publish this piece of research, which indeed shows that by the end of the research, 2 products out of 28,000 globally of these companies exceeded the standard. As I shared at the launch of the Replace progress report earlier this year with Dr. Tedros here in Geneva, those instances have since been fixed, and I'm happy to state that all the companies that signed up to this commitment have since met it 100%. So none of the products worldwide of these companies will now exceed, since 1st of January 23, the WHO standard for ITFA. Of course, TFA as such from natural sources is going to be present in products that contain ingredients of ruminant animal origin. And I know that that is also a scientific discussion on that, but it is not one that we can address in terms of product reformulation, because that TFA will be there. ITFA is the element that we can control. As IFPA, we've taken the initiative proactively to do so in line with WHO and with the same timeline as the WHO Resolve to Save Lives initiative. So I think it's a great example of collaboration. It's a great example of how we can come together and work towards and achieve a shared objective. Now, that collaboration is not going to be as easy for everything that we do. This is a specific substance. It's the substance where there is recognition, certainly by our companies, that it is not acceptable to have it in substantial amounts in products. And so other areas are more difficult because they're more nuanced. But this is nonetheless, I think, a case study worth celebrating. That said, our work isn't done. As IFPA, our commitment included a commitment to offer expertise and reach out to a degree to the wider food industry. We organized, for example, workshops in Nigeria and Pakistan in collaboration with the Sun Scaling Up Nutrition Business Network and some help from others. It became evident from those workshops that there are 2 big problems, and those 2 big problems are by now focused mostly in low and middle income countries. And those 2 problems are availability of suitable ingredients. So therefore, fats and oils that meet the standard. Once your inputs meet the standards, your outputs are going to meet the standards as a matter of course. So that's really key. And the second key is simply cost. And one thing is for a multinational to do this work. One thing is as a small producer of bakery goods in a low and middle income country that faces competitive pressures and so on and so forth. So those players in the food system need assistance. We developed and published a technical guide, a repository for the phasing out of ITFA in bakery goods and confectionery, because indeed these are 2 of the categories most susceptible to containing ITFA. Those are available from us, but have also been disseminated and made available to the broader food industry. That's not going to be enough either. I think it's going to require concerted efforts, focused in particular, I would say, on those countries where the problem is still very sizable and it's a public health issue. As IFPA companies, we stand available to support still in that endeavor, even though our commitment is achieved. And by the way, I don't think our companies will proactively be reporting from here on in terms of this particular commitment because it's been achieved. The standard will be maintained. So I would advocate for a more comprehensive approach to monitoring with a methodology that is over time refined and made accessible, let's say, to a broader section of the food industry. My last point is regulation is going to be important on this issue. We agree with that, and we will support that in line with the WHO standard. Thank you very much.
Please welcome Dr. Francesco Branca, Director of the Department of Nutrition and Food Safety, WHO.
Thank you. Good afternoon. Good afternoon. Global trans fat elimination by 2023 is one of WHO's bold initiatives driving us towards a healthier world for everyone. 39 countries have introduced best practice trans fat policies since the launch of Replace in 2018. We have had a six-fold increase in the number of people protected by the WHO recommended trans fat policies, from 550 million people to 3.7 billion. Just in the past 6 months, Bangladesh, Nigeria, and the United Arab Emirates have implemented trans fat policies. And I got a message from Sri Lanka that yesterday they've approved theirs. And Argentina, Egypt, Mexico, Paraguay, Philippines, Ukraine, and Sri Lanka, of course, are prepared to implement their own policies in the next 2 years. Congratulations. Today, nearly half of the world population in more than 50 countries is protected from the harms of trans fat in their food. And as we just heard, industry can play a complementary role. The commitments have demonstrated progress made by member companies of the International Food and Beverage Alliance has been meaningful. So thank you. WHO acknowledges the progress that the IFBA companies have made towards eliminating industrial trans fat in products, looks forward to the full achievement of the commitment by the end of the year. WHO calls on other companies, including fats and oil suppliers, to take similar action. While voluntary industry reformulation can be a supportive strategy for trans fat elimination, mandatory country regulations are needed to drive complete and equitable elimination. So that's why WHO created the Trans Fat Free Validation Program. And this program will officially recognize and validate countries for having a normative framework in place for being trans fat free. The validation program gives countries an opportunity to audit the processes established for trans fat elimination and to receive public acknowledgement of the progress received. Receiving the WHO validation certificate will confirm to the people in a country and to the international community that the country has eliminated trans fat and its harms. The program is open for application. WHO looks forward to formally recognizing the life-saving work of countries and hopes this validation certificate will encourage remaining countries to take action. But I'd like to hear today from those who have been on the front line to design and implement the policy. So I'd like to invite to the stage with a conversation with us the representatives of the government of Nigeria. So please welcome Mrs. Eva Edwards, the Director of Food Safety and Applied Nutrition of the National Agency for Food and Drug Administration and Control in Nigeria. Dr. Islam Bulbul, Program Manager, National Nutrition Services, Ministry of Health and Family Welfare from Bangladesh. And Mrs. Laila Sofia Moawad, Coordinator of International Cooperation from Anvisa in Brazil. Welcome. So I'd like to start with Mrs. Edwards. And again, congratulations on being the most recent country to pass a best practice regulation. This is a great success, and we really hope that Nigeria can be a leader from TFA for neighboring countries. So the bill is signed, but now comes enforcement. and we look forward to seeing Nigeria validated as trans fat free in the future. So what are the next steps in the implementation and enforcement?
Thank you very much. And I'm beyond honored to be here this afternoon. Thank you for recognizing the work that has gone into Nigeria's approving the regulations. So warm greetings from Nigeria. And our next logical step is to integrate the implementation and enforcement of these ITFA restrictions into our existing monitoring and enforcement systems. So our organization is a National Agency for Food and Drug Administration and Control. That's the regulator. We have the mandates to enforce, to implement, monitor, and enforce the ITFA restrictions. And so what we have already is we have strong presence in all states of Nigeria, in 36 states and the Federal Capital Territory. In those states, we have inspection activities. And so this means that we inspect the local industry. The inspection also goes beyond the local producers to inspecting at the ports of entry. And so that takes care of imported products. We have our enforcement activities in each of these states as well, all over the country. And what we also have is a network of laboratories which are accredited. And so this means that we are poised to take on the task of monitoring and enforcing the new regulations that we have just signed for the industrially produced trans fatty acids. I would also like to add here that even while we were still on the journey, and it was indeed an interesting journey getting to where we are at today, we already started taking some very valuable steps with successful implementation in mind. So we were collaborating and engaging with the industry, with the food industry. And the reason for this was to bring them on board early enough so that we could get their buy-in. We already assessed our laboratory capacity with support from Resolve to Save Lives, support from WHO. And the other thing we also did was to ensure that the industry players, we had workshops to train them. We trained the health journalists all across the country so that they could begin to tell the stories, write articles, and inform the general public about the harmful effects of the negative health consequences of consumption of industrially produced trans fatty acids. So we had an eye already to successful implementation, even while the regulations were still being revised. So with all of these on board, we are well set to integrate this into our current monitoring and enforcement systems. And we really look forward to success and progress as we go on. Thank you.
Thank you, Ms. Edwards. I think this is great, and the fact that Nigeria has a solid food control system is clearly the basis for this good monitoring and implementation. But I also appreciate your engagement with the public and civil society also to generate that demand for healthier food. So congratulations for that. I have a follow-up question for you. You've heard the report from IFBA. And you see that, what is the situation of the market of foods containing industrial trans fat? So is there, some maybe categories of products you'll be targeting in your monitoring?
Thank you. That's a very good question. I listened keenly when we had the presentation from ATNI and IFBA. And what struck me was that, yes, progress has been made. IFBA companies are they're the big industry. But our country context is that we have a significant number of micro, small enterprises. And baked goods, fried foods, these are really areas of concern for us. And from the study, we could see that this was also an area where, even though IFBA has told us that this has the two products, everything there up to 100%, but this is the big industry. We deal more with the micro and small enterprises. So we know we have our work cut out for us. So we'll put an eye on that.
And the street food. So yeah, absolutely. So you'll need to work on the ingredients and the availability of the ingredients of the oils. Yeah, thank you. And let me turn now to Dr. Bulbul. And really, I would like you're a bit more senior because your policy has been passed a bit earlier. But since then, what have you focused on? And tell us about the implementation challenges. Bangladesh is a huge country.
Thank you, Branka. First of all, I'd like to thanks sincerely to the organizer, and I'm most humble and honored that I'm representing my country. So this is really wonderful that we are considering food as medicine, not as poison. So we are still working together since past our the policy. You know that we have very good political commitment as well as engagement of our different institutions, especially Bangladesh Food Safety Authority and Bangladesh Standard and Technical Institute and also Institute of Public Health Nutrition. So all are working together that how we could make, building the awareness, not only for the people, but also the industrialists, especially the, small and medium entrepreneurs, because they are, mostly facing the challenges that how could they actually move forward, because it's a deal with livelihood as well as it's a deal with their, how they could actually reduce it, what might be technology they will use, so they face challenges. Additionally, as Nigeria told that they have focused it to the dailies, newspapers, engage the journalists so that they can actually identify what's the situation going on and how to resolve that. Second and third is engagement of the multi-sectoral collaboration, that is private sectors, academia, so that they can put some sort of research and generate the evidence that what is the situation, and policymakers can get the initiatives based on that research. Finally, that how we could actually engage the business network. You know that scaling up nutrition business network, through them we actually call upon most of the business owners in several workshop as well as several meetings, that how they could actually reduce the amount or eliminate the trans fat from their foods. And actually they even didn't know. So now they actually becoming aware to eliminate some sort of poisons from their food. This is a good sign, but still, as I mentioned, challenges. One is how the regulatory bodies acts to identify the potential challenges in the factories, as well as it deals with the livelihood of the people. So they actually trying to figure out that how could they minimize the amount of trans fat. So I hope that as we have started the journey since years, so it will be well in coming days. Thank you.
Thank you, Dr. Bulbul. And we appreciate that you rely also on the collaboration of other actors in society, academia for the monitoring. The manufacturers themselves, to just comply. But there's an important point in terms of the compliance, which is the replacement. So, what are they going to put instead of the oils containing trans fat?
Actually, when we called upon the industrialist, they suggested other things, but we told them to use the vegetables and other products instead of directly trans fat or all these things. So now they are trying to figure out that what actually they will use. Still, we are working on that issues. Let's see how it works. Yeah.
Thank you. Thank you. With the concern we have is, of course, that the products then take some kind of fats which are also not healthy, such as the saturated fat, and that's an important consideration. And then now, Ms. Mowad, I actually would like to ask you pretty much the same question, because also Brazil has a best practice policy since 2021. So what has the government done to ensure compliance and enforcement of the regulation?
Thank you, Dr. Branca. Greetings, everyone here today and also joining us online. Following the publication of our regulation in 2021, the Brazilian Health Regulatory Agency has taken some informative and educational actions. For example, we held a webinar open to the general public to provide context on the background on the restriction of industrial trans fatty acids, also technical aspects, public health considerations, and also to make the process transparent and inform subsequent steps. We also published on our website, at Anvisa's website, a frequently asked questions section available. It is made available on this topic, and it's been revised according to the questions that we have been received. So it is now at its third edition. And we are currently working on the elaboration of guidelines on technological options for replacing partially hydrogenated oils and fats in foods, and also guidelines on good practices for deodorization of oils and the use of oils for frying foods. We expect to complete these guidelines next month. In June. We also took several complementary normative measures, such as the revision of the standard, the national standard for sunflower oil, which is a possible substitute. We updated our standard. We updated the fatty acid profile for sunflower oils according to the Codex Alimentarius standard. So this has been already completed. We have revised the rules for declaration of trans fats and nutritional labeling also. And we are currently working on the revision of the rules for ingredient declaration to make the declaration of oils and fats clearer. We also established a partnership with the Federal University in Brazil to conduct a research of the amount of trans fats in certain food categories in Brazil. And this is this research is expected to be completed by the end of 2023. We also developed a specific online training to food inspectors of our decentralized national health surveillance system. We even organized a webinar to launch this online course and disseminate it widely within the state and local authorities in Brazil. And it is available for the authorities. We are also working with our inspection and laboratory system to develop an integrated and risk-based approach for monitoring and enforcement actions. So these are some of the actions that we have been developing since the publication of our regulation.
Thank you very much, Ms. Mowad. And actually, this shows us an incredible synergy between this nutrition objective and the control of the safety of food. So actually having a good food control system in place will be required really to have a good enforcement and monitoring mechanism for the elimination of trans fat. I know that from your biography, you're also the focal point of InfoSan, which is the international network. So maybe that's something we should consider. I mean, how InfoSan can actually maybe flag, the presence of food containing trans fat, and this could be actually help to go beyond the borders. So thank you very much. And my follow-up question to you is, are you going to apply for the validation program?
Yes, thank you for this question. Brazil would be very much interested in to pursue the WHO validation. We believe it would be positive for us to demonstrate that Brazil is in fact in alignment with the WHO guidelines and strategy for trans fat elimination. Yes, so we hope to apply for the validation, yes.
Good. We look forward to receiving that application. Thank you very much. So we don't have a lot of time, but maybe there's time for a couple of questions from the audience, if you like. I have a lot of other questions, but if you want to speak, please do that now or be quiet forever. Okay, so I'll ask another question to them. And my question is about basically the influence, and it's the same question basically, the three of you. What is the influence of your choice, of the choice of your government on your neighbors? And that's important because Nigeria is clearly a country which is at the heart of a food market. I mean, food producers, food importers. So how do you think that's going to affect your neighbors? And Bangladesh, there's a lot of momentum in South Asia. India, Bangladesh, and Sri Lanka, they all passed best practice policies. So, the neighboring one, Pakistan seem also to have done it, but Nepal, Bhutan, they could do that. What is missing? And maybe to you, Laila, Brazil is one of the 4 members of Mercosur, together with Argentina, Paraguay, and Uruguay, that pass best practice policies. So do you think that we can have an harmonization in the whole economic bloc? So, Eva.
Thank you very much for that question. And yes, Nigeria is like the big brother in the region. So I think that having approved our regulations, we're going to stand as a big example to our neighboring countries. And because we have similar contexts, aside from the fact that Nigeria is a very big country. And this is one of the reasons why, and also taking into account the huge numbers of our small and medium, micro and small scale enterprises, we decided to go for the limits rather than an outright ban on PHOs. So the countries around us, looking up to Nigeria and the fact that we have done this, we definitely want to get on board and also want to protect the lives of their population. But I don't want to say they'll go with the choice that Nigeria has made. We have chosen the limit because it suits our context. But it could be that a smaller country would decide to do an outright ban. But whichever of the two policy options, we're heading for the same endpoints. It's to protect lives. And so, yes,
Absolutely.
we're definitely going to set an example. And you know what the journey was like.
Yeah,
And so
complex.
we're really happy. We're really happy to be here, that we're at this point where we can stand as an example. If you permit me, just very quickly, just to give a word of advice to people who may also want to go the way we have gone. Collaboration, partnership, inclusivity, transparency, right from the beginning with industry and all the relevant stakeholders is very, very critical, because that is what, at the end of the day, saw us to where we got to.
Thank you. You need to have the buy-in. Yeah. Bulbul.
For the sake of the time, we can just copy and paste here. She's really correct that first we have to start with to limit that we have started to limit or keep it within less than 2%. So it might be, context with your country or with your region. Secondly is really important, that is generate the evidence or do work with some sort of based on any research or any example, then definitely engagement of all. So this is important. And finally, yes, to endorse any policy, you must have to the highest political commitment. So if you try to figure out that to understand your highest political body or the political leaders, so that actually work very well. And last thing is collaborative efforts with the partners. Bangladesh is really happy that Resolve's work, then Global Health Advocacy Incubator, they also works. Then other many, even WHO is always with us. So we sincerely also, provide our, grateful to them. So this might be sort of way that you can move forward. Thank you so much.
Thank you, Bulbul. And
Yes, thank you. Yes, I would say that I certainly hope that the regulations in place in Mercosur countries inspire other countries in the region. There are still some differences within the bloc, the Mercosur bloc, but we can see a movement towards the target among the countries of the bloc. And we certainly hope that other countries in the region follow the same path. We understand the relevance of regulatory convergence and regional integration. And I think that at this point, I would like to acknowledge the important role of PAHO, of the Pan American Health Organization, in also advocating and supporting countries in the region of the Americas to advance on the implementation of the global strategy in a more targeted way, addressing these specific needs for each country. Thank you.
well, thank you very much. And I think this is good news. And in fact, if we want to somehow accelerate even further, having regional economic blocs signing up to the elimination of industrial transfer is the way forward. We had incredible progress when European Union decided to go for the adoption of the trans fat regulation. So that brings us to the end of this panel. So please join me in thanking the panel for their, and congratulating again for the achievement in their countries. And maybe back to Stephen. So I'll maybe ask then Laura to come here for the final part. You can come.
Hi, everyone. Thank you so much for being here, and I want to really thank the panelists, our WHO colleagues, especially Francesco, our ATNI colleagues for their really informative report, and as well as IFBA for their response, and also the audience, both in the room as well as virtual. You know, I found this to be really interesting and helpful, and hope that for those of you listening, that it will help motivate to act to eliminate this toxic chemical from our food, saving hundreds of thousands of lives. You know, as Francesco mentioned, this year is a critical year for us. This is 2023, and the goal was always trans fat free by 2023. And as Francesco said, there has been really amazing progress to date. So, you know, I believe we've covered 47% of the globe with policies, and of that, you know, just in the last 5 years, you know, I think 40% of the globe in the last 5 years. So incredible, and, you know, a huge effort by many people. I just wanted to reflect really quickly on what I heard today. You know, I think for me, I've been working on this for 6 years now, and I do remember with the, you know, the original commitment by IFBA and its member companies. And so being here to hear and actually learn about the impact of that has been really great. And, you know, I just wanted to summarize some key takeaways that I took from it. So in general, I think obviously it's a hugely positive story. Only 2 products were found to have, you know, definitively not meet the limit. I think the other part of the story, though, is that it's still clear that there's a need for better data. You know, it took massive amounts of work and effort for the ATNI team and many years to pull together this data. And, you know, monitoring voluntary commitments is really hard. And that makes voluntary commitments, as Francesco said, kind of a supportive strategy as opposed to really our main strategy going forward. So, you know, it is really important, but I think, you know, passage of mandatory policies in country is still super critical to how we can go forward. And I think, as you heard from our panelists, you know, in Nigeria, for instance, you have so many micro industries and small industries, and you know, the companies, the IFBA companies are huge, and I think they maybe are 10% of the world market, but there's so much, especially in so many countries that are really not covered. So moving on to kind of the country experience, I just, you know, there's really been a wealth of country experience to date, particularly in the last 5 years around policy passage as well as implementation. And I think, you know, so much of what I heard on the panel really reflected that. I just wanted to reflect a few things. You know, I think what we heard is that policy passage is achievable, that some of the key things are inclusivity and transparency, political commitment. We also heard how important the support of groups like the WHO and PAHO, as well as some other partners, such as our partner at the Global Health Advocacy Incubator, and also I know our partners at NCD Alliance are here as well, who've been supporting the work in a few countries who are not on the panel. So I really think, you know, some places it's been a little faster. I think Brazil was relatively quick. Nigeria, it's been a bit of a long road, but we're so excited to be able to congratulate you guys at the end of the time. And I think, you know, as much as policy passages enforcement is important, Dr. Branca's questions really reflected implementation and enforcement. And, you know, some of the key themes that I heard today were the importance of really integrating implementation and enforcement into existing systems. What about your existing food control? How can you use that? Is the food safety system, how can that really be leveraged? Because we don't really want this to create a lot of additional burden on countries. It needs to be feasible. And then I think we heard from all of you about business outreach, and I was really excited to hear from Brazil about the different guidelines that you're putting together. I think that's so helpful, and I hope maybe can be shared with other countries when you're done. Perhaps something that could be useful globally and would be really great. So those were some of the key things that I heard today, and I just am, so pleased to be here today with you. Francesco stole a number of my talking points about the importance of regional action, as well as the leadership in the Sierra region now taking with Bangladesh, India, and Sri Lanka. But I think we are really excited about validation by WHO, and I think, given the importance of implementation and enforcement, we really encourage all countries that have a policy in place to put processes in place and apply for validation and to really be recognized for the efforts. So I think with that, I just want to thank everybody for coming. Thank you for listening both in person and online, and for I hope that some of you who have not been involved in trans fat elimination will potentially join with us moving forward and to help eliminate this toxic chemical and save lives. So thank you so much.